it is near Shine-Dalgarno sequence. Means that AUG which is near Shine-Dalgarno sequence would be the initiation codon. So I can say Shine-Dalgarno sequence determine the initiation codon and it is near AUG or upstream to AUG. Now we start second step, that is elongation. So I told you that initiation, elongation and termination. In elongation, first of all, look at this. This is initiation complex. I point out that in initiation complex, this is P site and this is A site. Where methionine is already attached, that is called P site, and the next codon is called A site, acceptor site. So we found that triple U code for phenylalanine. So transport RNA having phenylalanine will come and will bind to this A site. Now I have started elongation. In elongation, first step is binding of transport RNA to A site, and this binding require 1 GTP. After that, the next enzyme come into action. The name is peptidyl transferase. P4 peptidyl, P4 purple color I have taken. What is this function of this peptidyl transferase? This peptidyl transferase take one amino acid methionine from P site and transfer it to A site, and these two amino acid join by peptide bond. So peptidyl transferase make peptide bond and require no energy, no ATP, no GTP required by this peptidyl transferase. Now after joining these two amino acid, now there would be translocation. Means suppose this is messenger RNA, ribosome. Now you will push this ribosome over this messenger RNA. Means you are pushing ribosome over this messenger RNA. That is called translocation. Translocation you will push will require energy. So translocation require 1 GTP. So 1 GTP in translocation. Now after translocation, this become P site and next codon becomes A site. And now this comes out, it is called E site, exit. Now it is exit. So now acceptor site, again next transport RNA come and bind to this A site. Again peptidyl transferase make peptide bond. In this way, this protein synthesis is continuing. Now we come to termination of protein synthesis. Before termination, yes, elongation I told you, binding of transport RNA to A site that require 1 GTP. Then I told you peptidyl transferase make peptide bond and require no GTP or ATP. This is ribozyme because we found that this enzymatic activity is present in 28S ribosomal RNA. So RNA having enzymatic activity is called ribozyme. Then translocation. Translocation is done by elongation factor 2 and this use GTP, and this translocation is inhibited by diphtheria toxin. Diphtheria toxin, question is asked that diphtheria toxin inhibit protein synthesis by inhibiting elongation factor 2. Now we come to termination of protein synthesis when stop codon comes at A site. Releasing factor recognize stop codon and activate peptidyl transferase. Understand by animation. Now I start termination. This is A site. This is P site. When stop codon, UAG stop codon comes at acceptor site, releasing factor comes and recognize this stop codon and activate this peptidyl transferase. This peptidyl transferase cut polypeptide chain from P site. Point it out. Releasing factor is not releasing. Releasing factor recognize stop codon and activate peptidyl transferase. This polypeptide chain is cut from P site by which enzyme? Peptidyl transferase. So in termination of protein synthesis, when stop codon comes at acceptor site, releasing factor recognize stop codon and activate peptidyl transferase, and this peptidyl transferase cut or release polypeptide chain from P site, mnemonic. P for P site, P for polypeptide chain. Question is asked that polypeptide chain is released from P site. And who is cutting or releasing? That is peptidyl transferase, not releasing factor. This is misnomer. Point it out. And a question is asked, to add one amino acid in growing polypeptide chain, we require 2 ATP. In activation of amino acid, 2 ATPs are required, and 2 GTP in elongation. I told you, in elongation, 1 GTP by binding of transport RNA to A site, and 1 GTP by translocation. So to add one amino acid in growing polypeptide chain, we require 2 ATP plus 2 GTP. Sometime in question you will find 4 ATP because 2 GTP are equivalent to 2 ATP. So net 4 ATPs are required. Now we come to PCR, polymerase chain reaction, in which we are amplifying DNA in test tube. Suppose I give you this double-stranded DNA and I ask you, I want multiple copy of this DNA. You can amplify this DNA in polymerase chain reaction in test tube. So if you want to amplify this double-stranded DNA in test tube, what will you take? First of thing, DNA which is to be amplified should be taken in this test tube. Question is asked that in PCR, which of the following component is taken in test tube? Yes, first thing is target DNA, which is to be amplified. Now, when this DNA is there in test tube, we will heat test tube so that these two strands will be separated. We know whenever DNA replication occurs, two strands should be separated. So in test tube, we separate this double-stranded DNA with the help of heat. So first of all, double-stranded DNA we took. Now, before DNA synthesis, we always require primer. So two strands are separated by heat. Now, if you want to synthesize DNA, you require primer and one primer for each strand. So we will take two types of primer. So component of PCR, DNA to be amplified, target DNA. Two primer, one primer for each strand, two types of primer. Now we will take enzyme Taq polymerase, Thermophilus aquaticus, warm water bacteria, which can tolerate high temperature. If you will take normal polymerase, that will be denatured by heat. That's why we take Taq polymerase, that is warm water bacteria, which can tolerate high temperature. So derived from Thermophilus aquaticus bacteria. Now, so Taq polymerase is there. Now we want to synthesize DNA, so we will add deoxynucleotide also. So we add deoxynucleotide, not dideoxynucleotide. If you will add dideoxynucleotide, PCR will stop, DNA synthesis will stop. So dideoxynucleotide never a component of PCR. Substrate we add deoxynucleotide, not dideoxynucleotide. Other than we add magnesium, that is cofactor for polymerase, and buffer system is maintained. So these are the component of PCR. Now we started PCR. In PCR, we heated the test tube. Yes, when we heat, two strands are separated. Two strands are separated. That is called denaturation. Two strands are separated. Now, second step is annealing. We decrease the temperature. When we decrease the temperature, two types of primer attached to it. So primers get annealed, attached to DNA. Second step is annealing. Then Taq polymerase will come and will synthesize this DNA, and this is called extension, polymerization of DNA. So sequence is denaturation, annealing, and extension. So in a short period of time, we will find multiple copy of DNA because there would be exponential growth. 1 to 2, 2 to 4, 4 to 8, 8 to 16, 16 to 32. In a short time, multiple copy of DNA is obtained. But suppose due to any reason, due to any impurity, there is some problem. You put all the component in test tube or in thermocycler and you started PCR. Then in last, you found that due to any reason, this synthesis did not occur and you will get Babaji ka Thullu. That's why we started saying, no, we will monitor the PCR in real time. So in this PCR, if I add cyber green dye, now this normal PCR will become real-time PCR. What is the concept? we found that cyber green dye bind with double-stranded DNA and give fluorescence. Means cyber green dye will give fluorescence when attached to double-stranded DNA. So as PCR will increase the concentration of DNA. If PCR is going on 1 to 2, 2 to 4, 4 to 8, 8 cyber green dye bind to 8 double-stranded DNA, fluorescence increases. 8 to 16, fluorescence increases. 16 to 32, fluorescence increasing. Means if you want to monitor the PCR, just look at the fluorescence. If fluorescence is increasing, means PCR is going on. So you are monitoring the PCR in real time by adding this cyber green dye. That's why it is called real-time PCR. It is also called quantitative PCR. If I ask you at a particular point, can you tell me the concentration of DNA synthesized till now? You will look at the intensity of fluorescence. Yes, and you will say, yes, this much of intensity means this much of DNA has been synthesized till now. So this real-time PCR or quantitative PCR by adding the next component, cyber green dye. So till now we have discussed PCR, normal PCR, steps of PCR, question is asked. Now we discuss real-time PCR, that is also called quantitative PCR. Now we discuss RT-PCR, reverse transcriptase PCR is used to amplify RNA. Suppose this is RNA. First of all, reverse transcriptase will produce complementary DNA from this RNA. This complementary DNA will be amplified by PCR by polymerase. And loads of complementary DNA will be produced. These complementary DNA will produce RNA. So this is a reverse transcriptase PCR. And in this, we take thermophilus polymerase, death polymerase, because this polymerase has both activity of reverse transcriptase. Yes, reverse transcriptase activity is present in thermophilus polymerase, and polymerase activity is also there. So this is reverse transcriptase PCR used to amplify RNA. Next is advantage of PCR. It is quick, automated, highly sensitive, can be used to study RNA and as well as DNA. PCR can detect mutations. It can detect and quantify infectious agent even in latent state. Question has been asked, monkeypox detection is best done by real-time PCR. You know, monkeypox virus, double-stranded DNA virus, and detection is best done by real-time PCR. Now we come to restriction endonuclease. We found that there is an enzyme restriction endonuclease which cut palindrome region. What is palindrome? Palindrome, REFER. If you read in this direction or this direction, this is palindrome, same. If you read in both directions, sequence should be same. But this is not a good example, because when we remember this example, we think that palindrome is single-stranded DNA. But remember point, palindrome is first point, double-stranded DNA. In double-stranded DNA, I take example of palindrome. Suppose this is double-stranded DNA. In this, if I read from 5 to 3 direction on the upper strand, on this upper strand, first nucleotide is G, second nucleotide is G, third is C, fourth is C. In lower strand, if I read in 5 to 3 direction, again I will find the same sequence. First is G, second is G, third is C, fourth is C. So you can compare. In upper strand, first is G. In lower strand, first is G. In upper strand, fourth is C. In lower strand, fourth is C. Means in a palindrome, in both strand, if you read from 5 to 3 direction, sequence should be same. That is palindrome. So palindrome is double-stranded DNA, and restriction endonuclease cut palindrome. That's why palindrome is also called sometimes restriction site. Restriction site, because it is cut by restriction endonuclease. But in question, they will give you single strand. So to solve question, many times we make the second strand double-stranded DNA. But there is a simple trick. to solve question, how to identify palindrome. We found that if this is palindrome, then first nucleotide and the last nucleotide should follow the base pairing rule. G pair with C, G pair with C. Yes, they are following base pairing rule. So this is palindrome. So this is palindrome. I give you example. We found that this question was asked. They asked, is this palindrome? Yes, you will apply the base pairing rule. First and the last nucleotide, A normally base pair with T. So base pairing rule is followed. A pair with T. C pair with G. Yes, base pairing rule is followed. T pair with A, base pairing rule is followed. So this is palindrome. Another example, T base pair with A, base pairing rule is followed. A base pair with T, base pairing rule is followed. So this is palindrome. I give you another example, TAAT. If you will see it single strand, you may be confused. You will think of it as having palindromic property, but it's not palindrome. Yes, you can easily find T should pair with A, but it is T. It is not palindrome. Other option, A should pair with T, but it is not palindrome. A should pair with T. It is not palindrome. Answer is C. Now we come to blotting technique or hybridization. Southern blotting is done for DNA. Northern blotting is done for RNA. Western blotting is done for protein. Mnemonic is snowdrop. Snowdrop. Southern for DNA, Northern for RNA, Western for protein. Sometimes we say South dosa, North roti, West pizza. You can remember. One question sometimes asked that in Southern blotting there is DNA-DNA hybridization. In Northern blotting there is RNA-DNA hybridization. In Western blotting there is antigen-antibody reaction. Now we come to microarray or DNA chip. Sometimes image-based question may be asked. This is DNA chip. It can detect multiple mutations. It can do multiple gene expression analysis. It can do comparative genomic hybridization. Can detect single nucleotide polymorphism. If question is asked and you find the multiple mutation you want to detect, multiple gene expression you want to detect, answer would be microarray. Whenever you find you want to compare gene expression in two different cells, answer is microarray. Again, I am repeating. If you want to detect multiple mutation, multiple gene expression, microarray. If you want to compare gene expression in normal cell, cancer cell, or two different types of tumor cell, or two different types of normal cell, microarray. So this question, to determine global pattern of gene expression in two different type of tumor cells, which of the following technique would be most appropriate? Answer is microarray. A question recently asked that DNA protein interaction can be studied by using DNA footprinting. Before going to the concept, you will remember the mnemonic. We know that steroid hormone receptor bind to DNA. This is steroid hormone receptor, is a protein, bind to DNA. This is double-stranded DNA. And you know, steroid hormone receptors, they are two finger-like projection, 2 to 9 finger-like projections are there. And these finger-like projections are having zinc, and this is called zinc finger motif. So we found that these receptor or protein interact with the DNA by this foot. Yes, this is a mnemonic. This is a duck and having two feet. Yes, and this is interacting with DNA. So DNA protein interaction, mnemonic is DNA protein interaction is studied by this footprinting. So foot, these are foot. Okay. Now concept. If this DNA is attached with protein, then nuclease will not be able to cut at this site. Nuclease will cut at this site, but not at this. If DNA, yes, this is DNA, no protein is attached, then nuclease can cut from this. Fragments would be different. So if we do electrophoresis and we found that there is a gap, this is a gap, means no fragment, means this is DNA and protein are interacting. Due to this protein, nucleus was not able to cut at this site. That's why this is DNA footprint, no fragment here. In the same way, DNA protein interaction is there, so fragments not produced here. So this is DNA footprint 1, DNA footprint 2. You may find this image based question, and this recently asked question, DNA protein interaction can be studied by using DNA footprinting. Now we come to karyotyping. It is the best technique to detect monosomy and trisomy. Suppose I take a cell is in resting state, means it's not dividing. When I saw the nucleus, I found that the genetic material is present in the form of chromatin. Means I can't visualize chromosome when cell is not dividing. I stimulated the cell started dividing, prophase, metaphase. And you know that chromosome appear on equator in metaphase. I arrested the cell in metaphase with the help of colchicine. So in karyotyping, what I did, I stimulated the cell started dividing, prophase, metaphase. I arrested the cell in metaphase. So cells are arrested in metaphase using colchicine. In metaphase, all chromosomes lie at equator. And I can easily recognize if chromosome number 21 are 3 in number, I will say this is trisomy. If chromosome is only 1 in number, I will say monosomy. So best technique to detect monosomy or trisomy is karyotyping. But it is a lengthy process, lengthy process. Culture is required. You will stimulate, prophase, metaphase, then arrest. Yes, it cannot be done in any phase of cell cycle. I told you we have to do metaphase arrest. In metaphase, cannot detect microdeletion, amplification, complex translocations. So we have alternative technique to detect this microdeletion, amplification, that is FISH, fluorescent in situ hybridization. First of all, mnemonic F4 FISH, F4 fast. This is a fast technique. In I4 interface, FISH can be done in interface. I told you, yes, karyotyping is done in metaphase, but FISH can be done in any phase, including interphase. So it can be done in interphase. So in situ means done in morphologically intact cell, tissue, or organ. It is a rapid technique. I told you F4 fast, rapid technique, less than 24 hours required, as culture of cell is not required. Can be done in any phase of cell cycle, can be done in interphase, can detect microdeletion, amplification, monosomy, trisomy can be detected. It can detect gene location on chromosome, but FISH can't detect point mutation. Recently asked question in INICET. Yes, FISH is used to detect all of the following. It can detect translocation, amplification, deletion, but not point mutation. To detect point mutation, we have technique DNA sequencing, that is gold standard. Sanger sequencing, chain termination method. If you determine the nucleotide sequence, definitely is the best. Yes, you will find that what is the nucleotide sequence. If nucleotide sequence is changed, yes, you will say this is mutation. So point mutation, best technique, gold standard is DNA sequencing. Other technique is RFLP, restriction fragment length polymorphism. Another technique is single strand conformational polymorphism, SSCP. So these are common techniques to detect point mutation. Now CRISPR-Cas9 system. It is RNA guided nuclease system. First question. It causes double-stranded break in DNA editing. So what is CRISPR? CRISPR is clustered, regularly interspersed, short palindromic repeats. Cas9, CRISPR-associated endonuclease enzyme. What are the uses? Uses are gene deletion, exogenous gene insertion, multi-gene editing is possible, altering gene transcription and regulation. A recently asked question, non-homologous end joining is a major mechanism used by CRISPR-Cas9 for gene repair. So this question 2 times asked, by which mechanism does gene repair occur when mediated by CRISPR-Cas9? Answer is non-homologous end joining enzymes. All enzymes are protein except ribozyme. Ribozyme are RNA having enzymatic activity. Peptidyl transferase is enzymatic activity which is present in 28S ribosomal RNA. So 28S ribosomal RNA is having enzymatic activity, peptidyl transferase. So peptidyl transferase is ribozyme. Small nuclear RNA is having enzymatic activity which is used for splicing. So I can say small nuclear RNA is ribozyme. Most of the enzymes are protein and proteins are heat labile. So enzymes are heat labile. So enzymes are denatured by heat. If temperature curve of enzyme we found that if you increase temperature, enzyme activity increases initially. At a particular temperature, enzymatic activity become maximum. If you increase the temperature further, enzymatic activity decreases. Why? Initially it is increasing, maximum, then it is decreasing. Because after a particular temperature, enzyme is denatured. Yes, enzymes are protein, proteins are denatured by heat, and you know denatured protein can't do function. So as you increase temperature, enzymes are denatured, enzymatic activity decreases. So we found that this curve is bell shaped. So temperature curve of enzyme is bell shaped, and the same curve in pH. As pH increases, enzymatic activity increases at a particular pH maximum, then decreases, again bell-shaped curve with pH and temperature. Now we come to mechanism of enzyme action. First theory is lowering of activation energy. We found that this is the free energy of substrate, GS, and this is free energy of product. So you can say free energy of substrate is higher than the free energy of product. So substrate should be converted to product directly without any problem. But in nature, we found that if you want to make product, first of all, this substrate should reach this transition state. Means you have to put some energy that is called activation energy to take this substrate to transition state. Once transition state is achieved, then it will be converted to product very easily. And if you add enzyme, what will happen? You will add enzyme, then you will take this substrate to up to this transition state, this new transition state, and then it will be converted to product. So you can say this is activation energy without enzyme, this much, yes, yellow color, and this brown color is activation energy with enzyme. So there is lowering of activation energy. You can compare it with your life. You are MBBS. If you directly enter MD, you can do MD very easily. Means you are substrate, you can make product, means can do MD very easily, but they have put NEET PG exam, means you have to invest some energy, activation energy to reach this transition state, then you will become MD MS. What we are doing, we are behaving just like enzyme. We are helping you to achieve the new transition state with less effort. You can enter the NEET PG, clear NEET PG and enter the MDMS. So this is Gibbs free energy curve. Image based question is asked. When they will give you this image, you will identify this is Gibbs free energy curve. Second theory is Michaelis-Menten theory. Michaelis-Menten said that this is enzyme. This enzyme is having active site. Yes, this mouth looks like active site. This active site bind with substrate and they form enzyme substrate complex. So this is enzyme substrate interaction and enzyme substrate complex is formed. And when this substrate dissociate, it produce product. So enzyme bind with substrate to form enzyme substrate complex. When it dissociate, it produce product. Not a new thing. Rajnikant knows it very well. Rajnikant is enzyme. Chewing is substrate. Enzyme substrate interaction, and when this chewing is thrown, there is bomb. Chingam bump of Rajnikant means Rajnikant enzyme, chingam is substrate, enzyme substrate interaction occur when it dissociated, it form product. And he gave an equation that velocity of reaction is equal to V max into substrate concentration upon substrate concentration plus Km. It is a really difficult equation. And if you plot a graph between substrate concentration and velocity of reaction, you will find a hyperbolic curve. Hyperbolic curve. I take example. Suppose I take 10 enzyme in this solution and each enzyme is having one active site. So 10 enzyme will be having 10 active sites. And I add 10 substrate. How many substrate? 10 substrate in this solution. Now 10 active site will bind with 10 substrate and they will convert 10 substrate to 10 product in a unit time. You will say this is the velocity of reaction. Means I took 10 enzyme in the solution, I took 10 substrate and these 10 enzyme having 10 active site bind to substrate and convert them to product in a unit time, and we said this is the velocity of reaction. So 10 substrate will bind to 10 active site and will produce product in unit time. This is velocity. If I increase substrate concentration to 20, 30, 1000, then you have only 10 active site. So you can convert only 10 substrate to 10 product in unit time. Means if you further increase substrate concentration, velocity will not increase because all active sites are already occupied with the substrate. You can convert maximum 10 substrate to 10 product because you are having only 10 enzymes. So if we increase substrate concentration, there will be no increase in velocity of reaction because all active sites are already occupied by substrate. This is known as Vmax. So question is asked, single liner, Vmax is achieved when all active sites are occupied by substrate. So when all active sites are occupied by substrate, we will say this is Vmax. A question is asked that Kcat, that is catalytic constant or turnaround number. Kcat is Vmax upon total enzyme concentration. Vmax upon total enzyme concentration. That is called catalytic constant or turnaround number. And catalytic efficacy of enzyme is expressed by Kcat, catalytic constant, upon Km, Michaelis constant. So a question was asked that catalytic efficiency of enzyme is best expressed by which of the following kinetic constant? Answer was Kcat upon Km. Now, if we plot a graph between substrate concentration and velocity of reaction, we will find a hyperbolic curve. In this hyperbolic curve, this is Vmax, means maximum velocity which can be achieved. We found that this is Vmax. Maximum velocity, all active sites are occupied by substrate. If I take exactly half of this Vmax, half of Vmax, and we found that substrate concentration at which velocity of reaction is half Vmax is called Km. So Km is substrate concentration. Yes, on x-axis there is substrate concentration. So Km is nothing but substrate concentration at which velocity of reaction is half of Vmax. Direct question on the definition. Michaelis constant is substrate concentration at which velocity of reaction is half of Vmax. I take one situation, if substrate concentration is very, very large in comparison to Km, means substrate concentration is very, very, very large, suppose at this point, very, very large. At this point, velocity would be maximum, Vmax. If you further increase substrate concentration, yes, velocity will remain same. Means velocity will not depend on substrate concentration. If substrate concentration is very, very high, velocity would be Vmax constant. And if velocity is independent of substrate concentration, that is called zero order kinetics. So I take one situation that if substrate concentration is very, very large, velocity will be Vmax, means don't depend on substrate concentration. This is zero order kinetic. How you will make mnemonic? This graph I will make mnemonic by putting this graph like this, putting O at this point, randomly O. And I am putting 1 at this point. This is 1. 1. Okay. So at this point is 1 and at this point this is 0. Means if substrate concentration is very, very small in comparison to Km, then order of reaction will be first order of reaction. So you will remember by this diagram that if substrate concentration is very, very low, that is first order reaction and kinetic, and if substrate concentration is very, very high, this is zero order kinetics. You will remember like this. Now if substrate concentration is very, very low, then velocity is directly proportional to substrate concentration. This is first order kinetics. Now question is asked, in a reaction substrate is available in a concentration that is 1000 times Km. So substrate concentration is very, very large in comparison to Km. At this substrate concentration, velocity would be Vmax, means constant, zero order kinetics. After 9 minutes of reaction, 1% of substrate is converted to product. If the concentration of enzyme is changed to 1/3, means number of person doing the work are decreased. Enzymes decreased to 1/3. Previously, they used to do the same work in 9 minutes. When number of workers are decreased, they will take more time, 3 times more, means 27 minutes to do the same conversion of substrate to product. Concentration of substrate is doubled. So they try to confuse you that substrate concentration is doubled. Substrate concentration is already very, very high. Means if you further increase substrate concentration, velocity will not change. But if you decrease enzyme concentration, yes, time taken would increase. So answer would be 27 minutes. What is the time taken to convert substrate into same amount of product? That is, yes, 27 minutes. Now we come to Line-Weaver-Burke plot or double reciprocal plot. Double reciprocal plot. If we plot a graph between 1 upon substrate concentration and 1 upon velocity, then we will find this Line-Weaver-Burke plot. And this y-intercept is 1 upon Vmax. And this x-intercept is -1 upon Km. And the slope of this line is Km upon Vmax. This is double reciprocal. Why double reciprocal? Because this is graph between 1 upon velocity and 1 upon substrate concentration, Line-Weaver-Burke plot. Now we discuss enzyme inhibition, maybe competitive inhibition, non-competitive inhibition, and uncompetitive inhibition. Frequently asked question. Suppose this is enzyme, this is substrate, and this is inhibitor. In competitive inhibition, we found that inhibitor has structure similarity with the substrate. Yes, you can see the structure of substrate and inhibitor resemble. So structure similarity is there in competitive inhibition. Substrate bind to active site. We found that inhibitor also bind to active site because they have competition. So both bind to active site. When both bind to active site, affinity of enzyme towards substrate will decrease. Suppose there is a mother having only one kid. She will take care very nicely. If two kids are there, definitely some care will decrease. काला है तो मतलब प्यार नहीं करेगी क्या? प्यार तो उसे भी करेगी. Yes, means some affinity towards this inhibitor, some tendency to bind with substrate, some tendency to bind with inhibitor. So affinity towards substrate will decrease. So in competitive inhibition, affinity decreased, and you know Km is inversely proportional to affinity. So if affinity decreased, Km increased. And Vmax remains same in competitive inhibition. Vmax remains same. What does it mean? If I increase substrate concentration to 10 times, 1000 times, infinite, there are chances that all active site will be occupied by substrate. If substrate concentration is very high at that time, all active sites will be occupied by substrate. You will achieve Vmax. Vmax is achieved when all active sites are occupied by substrate. Means you can achieve Vmax. So Vmax remains same. So 1 upon Vmax also remain same. So these three are important to solve question on graph. For the time being, we know this competitive inhibition. Non-competitive inhibition. Inhibitor has different shape. Substrate is having different shape. Substrate bind to active site. Inhibitor bind at other site. So no structure similarity. Non-competitive, no structure similarity. They bind other than active site. Inhibitor bind at other than active site. Don't bind to active site. Means if it is binding here, it has no effect on this affinity. So no change in affinity, so no change in Km. So you can remember it very easily by mnemonic: non-competitive, no change in competitive Km. So this is mnemonic. I pronounce Km competitive like this. So we found that no change in Km, Vmax is decreased. So suppose a person is running and now you give him this very heavy stone, then he would never achieve maximum velocity. So Vmax is decreased. So 1 upon Vmax is increased. So these three important. Mnemonic is non-competitive, no change in Km. Now uncompetitive. If I write inverted U and write here Km, here Vmax. So both Vmax and Km are decreased in uncompetitive inhibition. Now questions are asked. They give graph. In graph, this is normal curve. This is normal curve. And this is after adding inhibitor. They are cutting each other. Yes, competitor cross each other, cut each other. So whenever you find a graph and in that graph you find that two curves are meeting, these are cutting. Okay, so this is competitive. This is cutting, this is competitive. You can easily remember by Vmax. This is Vmax. Vmax remains same. If Vmax is same, that is competitive inhibition. And this is 1 upon Vmax. So if 1 upon Vmax is same, this is competitive inhibitor. Example of competitive inhibitor: most pharmacological drugs usually inhibit competitively. Recently asked question: methotrexate inhibit dihydrofolate reductase. Question: statins inhibit HMG coenzyme reductase competitively. Question: dicumarol warfarin inhibit vitamin K epoxide reductase competitively. Question: malonate inhibit succinate dehydrogenase. Mnemonic MS Dhoni. Yes, malonate inhibit succinate dehydrogenase. Competitive inhibition. Now, non-competitive inhibition. No competition means you have won. You have won the sign of victory. First of all, when questions are asked, immediately looking at graph, you should find the answer. If you find the victory sign, yes, if you find the victory sign, then you will say no competition, non-competitive inhibition. Non-competitive inhibition. Now this is also victory sign, but with having erectile dysfunction. So this is again victory sign, non-competitive. And in non-competitive, no change in Km. This is Km same. 1 upon Km is same. So you can mark the answer by conceptually also. Yes, non-competitive, no change in Km, no change in 1 upon Km. So this is non-competitive. Example, most poisons, cyanide, carbon monoxide inhibit complex 4, cytochrome C oxidase. Fluoride inhibit enolase, non-competitive. Iodoacetate inhibit glyceraldehyde 3-phosphate dehydrogenase. Fluoroacetate inhibit aconitase. These are non-competitive inhibition. No competition, you have won. Victory. Now, uncompetitive, first of all, by mnemonic. Yes, whenever you find you, yes, if I do like this will appear me you. Yes, it appears just like you. This is also looking like you. So uncompetitive, yes, inverted U, both Km and Vmax decrease. So Km is decreased, new Km, new Vmax. So Vmax decrease, Km decreased. This is uncompetitive. Okay, so 1 upon Km increases, 1 upon Vmax increases. So I highlight 1 upon Vmax increases, 1 upon Km increases. So this is uncompetitive inhibition, simple mnemonic. If you find in curve U, that is uncompetitive. If you find victory, you have won, no competition left, non-competitive. In this is erectile dysfunction V. And if competition, they will cut each other. If cutting, that is competitive inhibition. Now suicide inhibition. This is irreversible inhibition. Example of suicide inhibition are aspirin inhibits cyclooxygenase by suicide inhibition. Allopurinol inhibit xanthine oxidase. This is another example of suicide inhibition. And question is asked, this is irreversible inhibition. Questions are asked on example, aspirin and allopurinol. They are suicide inhibitors. Now we come to classification of enzyme. All the enzymes are classified under 7 classes. Previously there were 6 classes. Now there are 7th class added in August 18. Recently added, that is translocase. So first class is oxidoreductase. Class number 1 or enzyme commission number 1. So sometime you will find the question that enzyme commission number 1 belong to oxidoreductase or oxidoreductase EC number is 1. So mnemonic is O41, ONE1. EC number 2, that is transferase, or class number 2 is transferase. We transfer between two things. So if you transfer between two things, mnemonic, yes, 2, EC number 2. Hydrolase enzyme cut a bond with addition of water, and water is having 3 atoms. So hydrolase EC number 3, enzyme commission number 3 or class number 3. Lyase, if I see lyase, Y looks like 4. Y looks like 4, so lyase EC number 4. Isomerase, S looks like 5. S looks like 5, so class number 5. Ligase, गे मतलब छक्का, sixer, so EC number 6. And the 7th class is translocase. Now one by one. First is oxidoreductase. Oxidoreductase further classified under dehydrogenase, oxidase, oxygenase and peroxidase. So oxidoreductase may be dehydrogenase, oxidase, oxygenase and peroxidase. Dehydrogenase means removal of hydrogen, and removal of hydrogen is called oxidation. And whenever hydrogen is removed, it is taken up either by NAD, FAD or NADP. If hydrogen is taken up by NAD, it forms NADH. FAD, it forms FADH. NADP, it forms NADPH. So this is dehydrogenase. Hydrogen acceptor are NAD, FAD or NADP. Now oxidase, enzyme would have oxidase in its name, just like cytochrome C oxidase. Common question, cytochrome C oxidase is oxidase or oxidoreductase. Third is oxygenase. Oxygenase means joining of oxygen. If you join one atom of oxygen, then it is monooxygenase. If you join 2 atoms of oxygen, then it is a dioxygenase. So if you join 1 atom of oxygen, this RH is converted to ROH. Yes, RH is converted to ROH, and OH means hydroxyl group. That's why monooxygenase produce hydroxyl group. So that's why it is called hydroxylase. And monooxygenase or hydroxylase require NADPH. Question is asked, monooxygenase require NADPH. Example of dioxygenase are homogentisate oxidase and tryptophan pyrrolase. Point it out, they are misnomer. Actually, this homogentisate oxidase, latest name is homogentisate dioxygenase, and tryptophan pyrrolase name latest is tryptophan dioxygenase. So example of dioxygenase. So oxygenase, monooxygenase use NADPH. Question is asked. And last, peroxidase. Now we come to transferase. Transferase transfer a group. All kinases are transferase. Hexokinase is transferase. Glucokinase is transferase. Phosphatokinase is transferase. And one question is also asked, all kinases require magnesium as cofactor. Other example of transferase are transaldolase, means name itself having trans word, transaldolase, transketolase, transaminase. One very important question, glucose is converted to glycogen, that is glycogen synthesis, rate limiting enzyme is glycogen synthase. Glycogen is converted to glucose, glycogenolysis, rate limiting enzyme glycogen phosphorylase. So I can say these both rate limiting enzyme are classified under transferase. So question was asked, rate limiting enzyme of glycogen metabolism are classified as transferase. So third is hydrolase. Hydrolase cut a bond with addition of water. Baba Ramdev told us, whenever you want to digest your food, take water after food. Take water after food. Okay, because yes, all digestive enzymes are hydrolase. Means all digestive enzyme cut a bond with addition of water. All proteolytic enzyme are hydrolase. Yes, lipase is hydrolase. Amylase is hydrolase. And arginase, आग, पानी, hydro मतलब पानी, आग और पानी. So arginase, आग, पानी, you will remember these are example of hydrolase. EC number 4, lyase. Lyase name itself is having lyase in few enzymes, just like HMG coenzyme lyase, arginosuccinate lyase, you will identify. Simple decarboxylase. Simple decarboxylase are also classified under lyase. S for simple, S for B6. Cofactor for simple decarboxylation is B6. Different question. We are talking about classification of enzymes, simple decarboxylation. Example, histidine to histamine, glutamate to GABA, tryptophan to serotonin. These are simple decarboxylation, and all these decarboxylase are lyase. And one more example, yes, your girlfriend, yes, you ask her, Aja Sham hone aayi. Your girlfriend was having acidity. She said, half enolai, means half H4 hydratase, A4 aconitase, L4 lyase, F4 fumarase, eno means enolase. So lyase, ly means lyase. Half enolai, lyase. So you will remember this mnemonic. Now, isomerase. Mutase is isomerase. Racemase is isomerase. Mutase animation. This is 3-phosphoglycerate, means phosphate is present at C3. Now enzyme is mutase. Mutase take this phosphate from C3 and transfer it to C2. So mutase transfer a phosphate group from C3 to C2, and the resulting compound is 2-phosphoglycerate. So if I ask you 3-phosphoglycerate and 2-phosphoglycerate, molecular formula are same. If molecular formula are same, they are isomer. So mutase is classified as isomerase. But questions are asked on definition also. Mutase transfer a group. Mutase transfer a group within a molecule. Within a molecule. But it is not transferase, it is isomerase. And example, just like phosphoglycerate mutase. Phosphoglycerate glycerate, mutase. I showed you the example by animation. Racemase is isomerase. Ligase use ATP. Use ATP. Yes. Lyase no ATP used. तोड़ना आसान है, जोड़ना मुश्किल. Lyase no ATP use. Ligase ATP is used. Example of ligase: synthetase, carboxylase. I told you synthase is lyase, no ATP used. But synthetase, ATP is used. Even in pronunciation, you require more energy. ATP is used, that is ligase. Carboxylase, ligase, and the class number 7 translocase ion, potassium, calcium. Now, this page is full of questions. A question was asked, they gave this image and they asked which curve is for hexokinase and which curve is for glucokinase. I remember hexokinase as helicopter and glucokinase as jet. Helicopter, how flies? Like this. And jet? So this is helicopter, yes, and this is jet. So you will identify. Questions are asked that hexokinase and glucokinase both catalyze the same reaction. They convert glucose to glucose 6-phosphate. When they catalyze same reaction, so they are isoenzyme. So isoenzyme are different form of enzyme which catalyze the same reaction. I told you hexokinase, glucokinase catalyze the same reaction. And all kinases are transferase. So I can say, so they are classified under same class. So in isoenzyme, mnemonic, conceptual mnemonic, in isoenzymes, only two things are same. Means they catalyze the same reaction and they are classified in the same class. Classification is same. Otherwise, any other property may be different. So isoenzyme, their other properties are different, their molecular weight is different, physical property different, electrophoretic property different, kinetics different, organ distribution different, but they catalyze the same reaction. Remember this mnemonic and you will solve all question. True of isoenzyme, 2 times question asked. Yes. Same rate of work. No, rate of work is different. Catalyze same reaction. Yes, isoenzyme catalyze same reaction. This is true. Have similar kinetics. No, kinetics are different. Yes, same quaternary structure. No, quaternary structure is different. Same group of classification is used. Yes, because they catalyze the same reaction. So I highlight, yes, this is true and this is true. All other properties are, yes, different. Have similar distribution of organ? No, different distribution of organ? False. So this is conceptual mnemonic of isoenzyme. Questions are asked, you can solve. Now, I again come to hexokinase and glucokinase. We found that hexokinase is distributed most of tissue, while glucokinase is present in pancreas and liver. Mnemonic is pilot. Jet is, yes, flight by pilot. P for pancreas, L for liver. If you want to travel a short distance, you will take helicopter. Yes, low kilometer. Although km is Michaelis constant, but we will remember low kilometer, you will use helicopter. If you want to drop a bomb to another country, Pakistan, yes, but we don't do like that. Yes, we drop love. If you want to drop love to Pakistan, you will use jet. So high km, high kilometer, high Michaelis constant. And you know km is inversely proportional to affinity. So if low km means high affinity. If high km means low affinity. So you will remember hexokinase as helicopter, glucokinase as jet. All question would be solved. Now, LDH, lactate dehydrogenase, 5 isoenzymes are there. LDH 1, 2, 3, 4, 5. LDH1 is found in heart mainly. Yes, how you will remember? एक ही तो दिल है, किस किस को दूं? एक ही तो दिल है, only one heart. LDH1 is present in heart. LDH2, रब ने बना दी जोड़ी means 2, रब RBC. RBC is having LDH2. And if you see blood, In blood, LDH2 is more than LDH1. So you will say LDH2 is too much. LDH2 is too much means LDH2 is more than LDH1. But in myocardial infarction, yes, myocardium death occur. So this LDH will be released in blood. So in MI, LDH1 will increase. In MI, LDH1 will increase than LDH2. So in MI, LDH1 is more than LDH2. Normally, LDH2 is more than LDH1. This is called flipped pattern of LDH, just like if you flip a coin and this is changed. Previously, LDH2 was above, now LDH2 is below. That is flipped pattern of LDH is seen in, yes, in myocardial infarction. Recently asked question. Now, few cofactors. Zinc, I remember zinc as gin. That is alcohol. You ask your friend, कार से alcohol ला दे. कार से alcohol ला दे. Car means carbonic anhydrase. Car means carboxypeptidase A and P. Alcohol, Al for alcohol dehydrogenase, Al for alkaline phosphatase, Al for aldehydatase. So cofactor is zinc. Gin. La de, lactate dehydrogenase. कार से alcohol ला दे. Gin ला दे, gin ला दे. So zinc, you will remember like this. These are having zinc as cofactor. Now copper is cofactor for tyrosinase. Question has been asked, I have discussed. Tyrosinase is classified as oxidase. Lysyl oxidase, name itself has having oxidase. Cytochrome C oxidase, that is complex 4 of electron transport chain, cytochrome C oxidase, and superoxide dismutase, copper is cofactor. So wherever you find oxidase, most of time you will find copper as cofactor. Yes, oxidase, tyrosinase, oxidase, lysyl oxidase, cytochrome C oxidase, complex 4, and superoxide oxide dismutase. We found that superoxide dismutase may be present in cytosol and mitochondria. In mitochondrial superoxide dismutase, yes, cofactor is manganese, Mn. But in cytosolic superoxide dismutase, C4 cytosolic, C4 copper. Yes, cytosolic superoxide dismutase, the cofactor is copper and zinc. While mitochondrial, this is recently asked question, superoxide dismutase, that is Mn manganese. Now we come to the last segment, vitamins. We have discussed something about vitamins in different topics. Now we will discuss that aspect which has not been covered and questions are asked. So vitamins are vitals in minute quantity and not synthesized in our body. But few exceptions are there. So I say vitamins are not synthesized in our body except vitamin D, niacin, which are synthesized by body. You know, 60 milligram of tryptophan give rise to 1 milligram of niacin, so synthesized by body. 7-dehydrocholesterol is converted to vitamin D3, synthesized by body. Now, another group which is synthesized in our body by intestinal flora. In our intestine, flora is there, bacteria are there which synthesize these vitamins. So synthesized in body by intestinal flora. Mnemonic is कौन बनेगा पति, not करोड़पति, कौन बनेगा पति. K for vitamin K2, minaquinone. बनेगा biotin. Pati, pantothenic acid. Now you can make one more mnemonic. If you see, you will find inside body by intestinal flora, minaquinone in, biotin in, pantothenic acid in. So all are having in. They are synthesized by intestinal flora. A question is asked, there is a patient who is having chronic illness, is being advised long-term antibiotic. Now he will present with which vitamin deficiency. So if patient is taking prolonged antibiotic use, intestinal flora will be disturbed and there would be vitamin K deficiency. Question is asked because vitamin K is synthesized by intestinal flora. Vitamins can be classified into fat soluble and water soluble. Water soluble BC, vitamin B and vitamin C. Fat soluble A, D, E, K. A, D, E, K, fat soluble vitamin. So these fat soluble vitamins are absorbed with fat and they require chylomicron. So if there is a patient having defect in the fat absorption, means fat malabsorption, pancreatic insufficiency is there. So clinical scenario, they will tell you that pancreatic insufficiency is there. Example, cystic fibrosis is there. There is malabsorption of fat. If malabsorption of fat would be there, fat soluble vitamin will not be absorbed. So there would be deficiency of fat soluble vitamin. So deficiency of fat soluble vitamin would be there. They give question that in cystic fibrosis, which of the following vitamin deficiency can be there? You know, B1, B6, vitamin C are water soluble. Only vitamin E is fat soluble. So in cystic fibrosis, malabsorption of fat, there may be deficiency of vitamin E. Now we start water soluble vitamins one by one. First is vitamin B1, that is thiamine. Question is asked, active form of vitamin B1 is thiamine pyrophosphate. And we found that vitamin B1 is cofactor for transketolase. This is frequently asked question. B1 is cofactor for transketolase. B1 is cofactor for oxidative decarboxylation. For the time being, B1 is cofactor for transketolase. And we know transketolase enzyme is used in HM patient. And in HM patient, no ATP is produced. So transketolase activity depend on vitamin B1. If a patient is having vitamin B1 deficiency, in that patient, transketolase activity will be decreased. So in B1 deficiency, RBC transketolase activity is decreased. So to detect B1 deficiency, we can check transketolase activity in RBC. So if in RBC transketolase activity is decreased, means B1 is deficient. B1 is present in grain allurone layer. So thiamine or B1 is present in allurone layer of grain. And when we do polishing, that this thiamine is removed or lost. So this thiamine is lost by polishing. So sometimes you will find the symptoms of B1 deficiency, I will discuss shortly, and they will give that patient is consuming polished rice. So it will indicate you that polishing of rice or polishing remove allurone layer, thiamine deficiency may occur. Parboiling. If you do parboiling, this parboiling attach allurone layer to grain. So if you do polishing after that, then B1 will not be lost. Thiamine will not be lost. If you do parboiling, yes, attach allurone layer to grain, so not lost by polishing. If B1 is deficient, berry, so B-E-R-I, I1. So berry, B1 deficiency. Maybe dry berry, wet berry. Most of time you will find clinical scenario, and in that clinical scenario, you will find high output cardiac failure. Quite suggestive of wet berry. They will give you the history also that polishing rice, alcohol intake is there, and now patient is having lactic acidosis. In B1 deficiency, lactic acidosis is also there, and high output cardiac failure is there, wet berry. Dry berry, neurological symptoms would be there, symmetric motor and sensory neuropathy, tenderness, cramps are there. And we know that alcohol use, chronic alcoholic patients are having B1 deficiency. Alcohol is a very important cause of B1 deficiency. Alcohol inhibits absorption of vitamin B1. And due to this B1 deficiency, we found that there may be acute precipitation complication, Wernicke's encephalopathy, in which symptoms are mnemonic Goa. If you go to Goa, you don't wear clothes. Wernicke, wear nahi kiye clothes in Goa, and you take alcohol. And so much of alcohol, global confusion. You are so confused, you enter in the room of another person. Yes, ophthalmoplasia, now you are looking two person at a time. Yes, ataxia, kadam ladkhada gaye. So Goa, global confusion, ophthalmoplasia, ataxia. And in this, there is lesion in a mammillary body. You can remember mnemonic W. If you rotate this W, it will look like M. Yes, or nature has given this mnemonic. Vierney, Goa, alcohol, mammillary. So all these are related to each other. So this is an acute complication of B1 deficiency, Wernicke's encephalopathy. Chronic complication of B1 deficiency, Korsakoff psychosis. In this, there is anterograde amnesia and confabulation. What are the common cause of B1 deficiency? Polystyrese, I told you, polishing, remove thiamine, vitamin B1. Chronic alcoholic intake, B1 deficiency. Chronic use of diuretic also lead to B1 deficiency. Bariatric surgery lead to B1 deficiency. Vegetarian diet, if you are pure veg, then there would be deficiency of B12, not B1. So this question was asked, which of the following least likely cause beriberi? Answer was vegetarian diet. Vegetarian diet, pure veg diet will lead to vitamin B12 deficiency. Next water soluble vitamin is vitamin B2, riboflavin. Active form of riboflavin is FMN FAD. FMN FAD. Ribo, remember as rubro. Ribo, rubro. Rubro means red. So vitamin B2 deficiency, red eye, red tongue. Red eye means circumcorneal congestion keratitis. Red tongue may be magenta color tongue, red tongue. There would be glossitis, angular stomatitis. So chillosis, angular stomatitis, glossitis, magenta color tongue, keratitis, circumcorneal congestion. These are the symptoms of vitamin B2 deficiency, and you can make another mnemonic if you fantasize with the ribbon of magenta color, and all these symptoms can appear. It depends on your fantasy. Yes, if you do blindfold, there would be, yes, keratitis, circumcorneal congestion, and yes, these angular stomatitis may be there. It depends on you. You know better than me. Yes. Now I make mnemonic that ribbon and glue are used in art and craft. So I will remember mnemonic that to measure or to detect B2 deficiency, we measure glutathione reductase activity in RBC. So glutathione reductase, glue and riboflavin. So they are used in, yes, art and craft. So to detect B2 deficiency, we measure glutathione reductase activity in RBC. B3 niacin deficiency we have discussed in detail with pellagra, tryptophan metabolism. For the time being here, B3 niacin can cause toxicity. Water soluble vitamin don't cause toxicity, but niacin can cause toxicity, and symptoms are flushing, itching, redness. These are due to prostaglandin. So these symptoms are prostaglandin mediated. So these symptoms can be prevented by prescribing aspirin. So can be prevented by aspirin. Symptoms of niacin toxicity, flushing, itching, redness. These are prostaglandin mediated. Now B5, 5-pentothenic acid, 5 finger, toes, 5 toes. Burning foot syndrome, mnemonic, burning foot syndrome in the deficiency of pentothenic acid. Pento means 5, so 5 toes in fit. So mnemonic, burning foot syndrome in B5 deficiency. Now B6, active form of B6 is a pyridoxal phosphate, and we found that cofactor for transaminase, and we found that B6 is a cofactor for transaminase. So to detect B6 deficiency, we check erythrocyte transaminase activity. B6 is cofactor for simple decarboxylation, mnemonic S46S4 simple decarboxylation, O41 O4 oxidative decarboxylation. B1 is cofactor for oxidative decarboxylation, B6 is cofactor for simple decarboxylation. In simple decarboxylation, histidine is converted to histamine, glutamate is converted to GABA, tryptophan is converted to serotonin, dopa is converted to dopamine. These are simple decarboxylation, and cofactor is B6. In deficiency of B6, you will remember 6X. Oxaluria, xanthurenic acid urea, X. Homocystinuria, X. Cystinuria, I do 16uria, X. So B6 deficiency, oxaluria, xanthurenic acid urea, homocystinuria. B6 can also do toxicity. I told you water-soluble vitamin don't do toxicity, but B3 and B6 can cause toxicity. S for sensory neuropathy, numbness and tingling sensation, B6 toxicity. Now we come to folic acid or vitamin B9. Folic acid is also called vitamin B9. Folic acid, folium. Folium means leaf. So if you see leaf, you will find zigzag edges. So zigzag means jejunum. Folic acid is absorbed in jejunum mnemonic. Folic acid, folium, leaf, zigzag, and so it is absorbed in jejunum. And source of folic acid is green leafy vegetable. Source, green leafy vegetable. And if you heat, folic acid is lost. If you heat, folic acid is lost. We found that folic acid is converted to dihydrofolate. This dihydrofolate is converted to tetrahydrofolate by enzyme dihydrofolate reductase. And this dihydrofolate reductase is inhibited by methotrexate question. Active form of folic acid is tetrahydrofolate. Now we come to vitamin B12 cobalamin. Absorption of vitamin B12. We found that in stomach, parietal cells secrete glycoprotein known as intrinsic factor. So parietal cell in stomach secretes glycoprotein known as intrinsic factor. This intrinsic factor bind with B12 to make a complex, form intrinsic factor B12 complex. Now intrinsic factor B12 complex is absorbed in ileum. Point it out. Folic acid is absorbed in jejunum. We discussed folic acid first, then I am discussing B12. So first part of intestine, jejunum absorb folic acid, and next part of intestine, ileum absorb vitamin B12, cobalamin. What are the common cause of vitamin B12 deficiency? Those are pernicious anemia. In a vegetarian person, B12 is not present in vegetarian food. So if a strict vegetarian person is there, there are chances of B12 deficiency. Gastrectomy. If you do gastrectomy, means stomach is cut. And you know, if you want to absorb B12, you also require intrinsic factor. Intrinsic factor comes from stomach, parietal cell. So if gastrectomy, atrophic gastritis, that can lead to B12 deficiency. Deficiency of B12. Sign and symptom, megaloblastic anemia, homocystinuria, we have discussed with sulfur-containing amino acid in detail. Here I will point out that in B12 deficiency, there would be neurological symptom, progressive peripheral neuropathy, because there is increased methylmalonyl coenzyme A. Methylmalonic acid is increased. And there is subacute combined degeneration of spinal cord. Demyelination is there. This feature is unique to B12 deficiency. Why I am saying B12 deficiency, this symptom is unique? Because clinical scenario will be there that a patient present with tiredness, fatigue, megaloblastic anemia, homocystinuria. We know that homocystinuria, megaloblastic anemia present both in B12 deficiency and B9 deficiency, folic acid deficiency. So sometimes they will give you question on the basis of dietary pattern. Means if they give that pure vegetarian person is there, you will understand that if pure veg is there, deficiency would be B12. If they give that non-vegetarian person is there, rarely take vegetables in diet, so folic acid deficiency may be there. Although this is not the diagnostic point, but in a clinical scenario, sometimes they want you to know that what dietary pattern determine deficiency of B12 or B9. Other than these things, you will find that methylmalonyl coenzyme A is increased in B12 deficiency. In B12 deficiency, methylmalonyl coenzyme A will not be converted to succinyl coenzyme A because there is enzyme mutase. Mutase require B12. If B12 is deficient, this methylmalonyl coenzyme A is not converted to succinyl coenzyme A. So methylmalonyl will increase, methylmalonyl aciduria will be present in B12 deficiency, while methylmalonyl coenzyme A level would be normal in B9 deficiency, folic acid deficiency. In B12 deficiency, there would be subacute combined degeneration of spinal cord. Yes, in folic acid deficiency, these symptoms would not be there. There is a list of vitamin and test done for them. B1 deficiency, thiamine deficiency, we do RBC transcriptolase activity, T4 thiamine, T4 transcriptolase activity. Vitamin B2 deficiency, riboflavin, ribbon, glue. Yes, ribbon and glue are used in art and craft. I made mnemonic. So riboflavin deficiency, RBC glutathione reductase activity. B6 pyridoxine or pyridoxal phosphate, RBC transaminase activity or tryptophan load test is done for B6. B9 folic acid, F4 folic acid, F4 Figlu excretion or histidine load test. Question is asked that Figlu is metabolite of histidine. So you will remember easily B9 folic acid, F4 folic acid, F4 Figlu excretion or histidine load test. B12 cobalamin or methyl cobalamin, M4 methylmalonyl level. Question is asked that if family consume only polysterized means B1 is deficient, and if B1 is deficient then transcriptolase activity will be affected. So combination of vitamin deficiency and enzyme defect will be present in this family. Answer is B. Now we come to vitamin C or ascorbic acid. I remember it as absorbic acid because vitamin C helps in the absorption of iron. Vitamin C convert ferric to ferrous. So vitamin C helps in absorption of iron by converting ferric iron to ferrous iron. We know that iron is absorbed in ferrous form. So if vitamin C is deficient will cause microcytic hypochromic anemia. Vitamin C is required for hydroxylation of proline and lysine. Means proline is converted to hydroxyproline, lysine is converted to hydroxylysine, and in this vitamin C is required. Mnemonic is C, samundar is having water. Water means hydroxy. I remember a song कि सारा समुंदर मेरे पास है, एक बूंद पानी मेरी प्यास है, तो पी ले. So water, hydroxy, pee le, proline, lysine, hydroxylation, convert proline to hydroxyproline, lysine to hydroxylysine with the help of vitamin C, and this helps in post-translational modification of collagen. So this is post-translation modification of collagen. Vitamin C is required. So if vitamin C is deficient, then collagen would not be proper, means collagen formation would be defective, and that will lead to scurvy, bleeding gum, inflammation of gum, tooth loss, easy bruisability, subperiosteal hemorrhage, petachy, increased bleeding time, poor wound healing. You know that collagen is required, yes, or helps in wound repair and healing. So if collagen is defective, there would be poor wound healing or delayed wound healing. Question is asked. Anemia, I told you microcytic hypochromic anemia because vitamin C helps in the absorption of iron. Recently asked question, that is white line of Frankel on X-ray would be there in vitamin C deficiency. A question is asked that we can't synthesize vitamin C in our body because we are having deficiency of an enzyme, that is L-gulonolactone oxidase. So humans cannot synthesize vitamin C due to deficiency of L-gulonolactone oxidase. Recently asked question, post-translational modification common to collagen, hemoglobin and immunoglobulin. I just discussed that collagen post-translation modification is by hydroxylation of proline and lysine. But this hydroxylation is only for collagen. They have asked common to collagen, hemoglobin, immunoglobulin. You know, subunit aggregation occur in hemoglobin, immunoglobulin and collagen. Yes, in hemoglobin 4 globin chains are there, they join, aggregate. Immunoglobulin, yes, heavy chain, light chain, yes, subunit aggregation. Collagen, subunit aggregation is there. So answer is C. Now we come to vitamin A. Vitamin A deficiency, earliest symptom or manifestation is night blindness. So earliest symptom manifestation is night blindness. Most specific manifestation of vitamin A deficiency is bitote spots. In bitote spots, you will find this image-based question. There is a triangular foamy lesion at bulbar conjunctiva. So, bitote spot is foamy, triangular foamy appearance in bulbar conjunctiva due to superficial deposition of keratin in conjunctiva. So, in vitamin A deficiency, you will find xerophthalmia, night blindness, bitote spot. Answer is vitamin A deficiency. Vitamin A deficiency can also lead to phrenoderma. This is follicular hyperkeratosis due to vitamin A deficiency. In this, you will find that dry, scaly skin, and sometimes it is described as toad-like skin. So, follicular hyperkeratosis due to vitamin A deficiency, dry, scaly skin, toad-like skin at elbow and knees. And we found that phrenoderma is also associated with essential fatty acid deficiency. So phrenoderma also occur in essential fatty acid deficiency. Vitamin A toxicity. Clinical feature is raised intracranial tension resembling brain tumor, so known as pseudotumor cerebri. So vitamin A toxicity lead to pseudotumor cerebri. Now we come to vitamin E, that is alpha tocopherol. Alpha tocopherol, it is most potent lipid phase antioxidant. Most potent lipid phase antioxidant. It is chain breaking antioxidant. It protects RBC membrane from free radical. It is antioxidant, so it will prevent RBC from free radical. So if vitamin E is deficient, this RBC membrane will not be protected and there would be hemolysis. So in vitamin E deficiency, in clinical scenario, many times you will find hemolysis. We found that vitamin E is having anti-atherogenic property because it converts oxidized LDL back to normal LDL. What are the features of vitamin E deficiency? I just told you it leads to hemolysis due to lack of protection of RBC from free radical damage. In vitamin E deficiency, you will find neurological presentation just like B12 deficiency. In B12 deficiency, I told you subacute combined degeneration of spinal cord is there, neurological symptoms are there. And in B12 deficiency, megaloblastic anemia is there. But in vitamin E deficiency, similar are just like B12 deficiency. Neurological symptoms are just like B12 deficiency, but no megaloblastic anemia. So neurological presentation similar to B12 deficiency. Progressive peripheral neuropathy would be there. Progressive external ophthalmoplegia. Yes, this is important. Yes, spinocerebellar ataxia, vitamin E deficiency, and also hemolysis. Important. Vitamin D. Synthesis questions are asked. Vitamin D is also called sunshine vitamin. So, in liver and intestinal mucosa, cholesterol is converted to 7-dehydrocholesterol. This 7-dehydrocholesterol in skin is converted to cholecalciferol, that is vitamin D3. Vitamin D3 by ultraviolet rays. By ultraviolet light. That's why we say you should go in, yes, sunlight. Just like jadoo. Jadoo ki tarah dhoop khani hai tumne. Yes, because in sunlight, you will be able to convert this 7-dehydrocholesterol to cholecalciferol D3. It occurs in skin. Now this cholecalciferol or vitamin D3 go to liver. In liver, it is converted to 25-hydroxy D3 by 25-hydroxylase. So this is frequently asked that in liver, there is hydroxylation at 25 position. How you will remember? A Ayurvedic medicine leave 52. If you reverse 52, that is 25. So in liver, there is 25 hydroxylation. This 25-hydroxy D3 will reach kidney. In kidney, this will be converted to calcitriol, 125-dihydroxy D3 by 1-alpha hydroxylase. This is rate limiting enzyme. and this is occurring in kidney. So question is asked, yes, kidney attach OH group at first position. बच्चा एक ही अच्छा. Kid, बच्चा एक ही अच्छा. So calcitriol is having 3 hydroxyl group. Yes, calcitriol, triol. One OH is present in cholesterol. One OH attached in kidney at position 1. बच्चा एक ही अच्छा. One OH is attached by liver, leave 52 mnemonic. And this 1 alpha hydroxylase is activated by parathormone, PTH. And question is asked on the steps occurring in skin, liver and kidney. What is the sequence? Mnemonic is silk. Mnemonic is silk. As for skin, first occur in skin, then liver, then kidney. A recently asked question that laryngismus stridulus is due to deficiency of vitamin D. Laryngospasm is due to vitamin D deficiency. Now we come to vitamin K. Vitamin K is associated with coagulation. I write coagulation like this. K for vitamin K, G for gamma carboxylation, and G for glutamate. So vitamin K is responsible for post-translational modification by attaching carboxyl group at gamma position of glutamate. You will understand like this. We found that clotting factor 2, 7, 9, 10. 2 plus 7 is equal to 9 and the next is 10. This is mnemonic. 2 plus 7, 9. The next is 10. We found that clotting factor 2, 7, 9, 10 and protein C and S are activated by gamma carboxylation of glutamate. Means this is, suppose clotting factor 2, 7, 9, 10. In this clotting factor, one amino acid is glutamate. If you don't remember the structure, it's okay. Just have an idea. This is glutamate. In this glutamate amino acid, this is alpha position, beta position, gamma position. At this gamma position, there would be carboxylation. Means you will attach carboxyl group at this gamma position of glutamate. So if you attach carboxyl group here, so it will be converted to this gamma carboxyglutamate. Means in this glutamate at gamma position, carboxyl group is there. So if this clotting factor 2, 7, 9, 10 want to be activated, first of all, this 2, 7, 9, 10 glutamate should be converted to gamma carboxyglutamate. Now these clotting factor will be activated. So question is asked that post-translational modification of clotting factor 2, 7, 9, 10 is done by gamma carboxylation of glutamate, and in which vitamin K is required. So this is vitamin K cycle I am discussing. In this, vitamin K dependent carboxylase will do gamma carboxylation. And when this reaction would occur, this carboxylation would occur, this vitamin K will be converted to epoxide form. So vitamin K itself would be converted to epoxide form. This epoxide form should be converted back to reduced form. And in this conversion, first enzyme is epoxide reductase. And this epoxide reductase is inhibited by warfarin dicumarole. This question is asked. They will give you this vitamin K cycle and they will tell you that this is enzyme inhibited by a drug. What is drug? The drug is warfarin or dicumarole. So this is post-translational modification of clotting factor 2, 7, 9, 10, protein C and S. This is the question. Which of the following clotting factor requires gamma glutamyl carboxylase? That is factor 2, 7, 9, 10. If vitamin K is deficient, then clotting factor will not be activated. If clotting factor will not be activated, there would be bleeding, easy bruisability, ecchymotic patches would be there, prothrombin time will increase, And there is a very important concept, hemorrhagic disease of newborn. I told you the mnemonic कौन बनेगा पति. Vitamin K, biotin, and pantothenic acid are synthesized by intestinal flora. So newborn baby, there is no intestinal flora because intestine of newborn is sterile. That's why vitamin K will not be synthesized. This is the reason all newborn are given vitamin K injection. Now we come to Wilson disease and Menkes disease. Questions are asked that in Menkes disease there is copper deficiency. In Wilson disease there is copper excess. How you will remember? If you write M and put arrow downward means copper is decreased. Wilson W, arrow is upward, copper is increased. You know. But question is asked that in Menkes disease there is defect in ATP7A protein, while in Wilson disease, there is defect in ATP7B protein defect. How you will remember? Wilson, sun means beta, B for beta. Yes, so 7B in Wilson and 7A in Menkes disease. Menkes disease is X-linked recessive, while Wilson disease is autosomal recessive. In Menkes disease, copper is deficient, and you know that tyrosine is converted to melanin by enzyme tyrosinase. Tyrosinase require copper as cofactor. In Menkes disease, copper is deficient, so tyrosine will not be converted to melanin, so black pigment will not be produced, so there would be gray depigmented hair. Menkes kinky hair syndrome. In Menkes disease, brittle kinky hairs would be there. As you know, copper is also cofactor for lysyl oxidase. So lysyl oxidase will be affected. So collagen would be weak and defective. And when collagen would be weak and defective, there would be kinky hairs, brittle hairs. Sometime image-based question, gray depigmented brittle hair, you may find these images. Now we come to zinc deficiency. Symptoms are mnemonic hide, H for hypogonadism, H for healing, delayed or poor wound healing, I for immunity, decrease immunity, D for diarrhea. So in zinc deficiency, there are hypogonadism, delayed wound healing, decreased immunity, diarrhea. There is a disorder, acrodermatitis enteropathica. Name itself tells you that there would be dermatitis, there would be diarrhea, So diarrhea, dementia, dermatitis. Yes, that is different. 3D pellagra. But in this, diarrhea and dermatitis is there. And this dermatitis is typical. That is periorificial, acral region. So acrodermatitis, enteropathica. Acro means there would be tip of fingers. Yes, tip of fingers, dermatitis would be there. Periorificial lesion. Yes, periorificial. Perioral. So inflammation around nose, inflammation around mouth, anus, cheek, elbow. This periorificial and acral dermatitis is there. And diarrhea is there. Why it is occurring? Because acrodermatitis enteropathica is an autosomal recessive disorder in which there is defect in the absorption of zinc from intestine. So if zinc absorption is defective, zinc deficiency would be there, leading to acrodermatitis enteropathica. This question was asked. A child presented with erythematous scaly patches in periorificial mucosal ulcer, impaired epithelial wound healing. I told you zinc deficiency lead to delayed wound healing. The most likely mineral deficiency associated with this condition, they give this image also, periorificial and acral region, zinc deficiency. Now selenium deficiency, you may remember Selena Jetli, Selena Gomez. Deficiency lead to Keshan disease. Kesh, in Hindi बालों को केश कहते हैं. Yes, when you see the hairs of or case of Selena Jetli, yes, immediately your heart will be having myopathy, cardiomyopathy. You may remember like this. Cation case of Selena Jetli, Selena Gomez will produce cardiomyopathy, muscular weakness, and muscular dystrophy. Question is asked a buffer that is most effective at pH 8.3. You will make mnemonic that this buffer is most effective at 8.3 pH. Phosphate buffer is most effective at 6.8. Bicarbonate is most effective at 6.1. How you will remember this? If I write 3 times 3, 1 3, 2 3, third 3, 8.3. Yes, trace buffer. Bicarbonate, if I write B, small b, I and dot of I here, this is bicarbonate. Yes, 6.1. B looks like 6. Phosphate, 6.8. Rhyming. Acetate, 4.7. So buffer most effective 8.3 is trace buffer. Question is asked on RQ. RQ respiratory quotient is CO2 produced upon O2 utilized. In carbohydrate, prototype is glucose, that is C6H12O6, bind with 6O2 to produce 6 CO2 and 6 H2O. So when carbohydrate is oxidized, CO2 produced is 6 and O2 utilized is 6. 6 by 6, 1. So RQ for carbohydrate is 1. Question is asked that RQ of fat is 0.7. How you will remember? If you write F and rotate this F, it would become 7. 0.7. Protein 0.8. RQ of mixed diet is 0.85. Now we come to xenobiotics. Definition. They are foreign substance to human body. They may be drug or toxin. So they are toxin. So they must be detoxified. So detoxification of xenobiotic occur in liver. So major organ of detoxification is liver. Mainly these substances are thrown out of body by kidney. So xenobiotic reactions occur in two phases. Phase 1 reaction, phase 2 reaction. Phase 1 reaction make compound hydrophilic or polar. And you know that to make compound polar we can add OH. OH is hydroxyl group. So in phase 1 reaction is, yes, hydroxylation. And I told you monooxygenase is also called hydroxylase. So hydroxylation or monooxygenation. So phase 1 reaction example, hydroxylation or monooxygenation, oxidation, reduction are example of phase 1 reaction which make the compound polar or hydrophilic. Phase 2 reaction makes compound more soluble and now it is thrown out of the body via kidney. And phase 2 reaction example are conjugation. Yes, glutathione conjugation, glycine conjugation, glucuronic acid conjugation. So phase 2 reaction example conjugation, phase 1 reaction example hydroxylation. This is most common. Phase 1 reaction, conjugation is most common. Phase 2 reaction. Now we come to heme synthesis. Heme synthesis, succinyl coenzyme A bind with glycine to form delta aminolevulinic acid. By delta aminolevulinic acid synthase, this is a rate limiting enzyme of heme synthesis. So succinyl coenzyme A and glycine bind to make delta aminolevulinic acid, and this rate limiting enzyme aminolevulinic acid synthase cofactor is B6. Aminolevulinic acid synthase, the rate limiting enzyme, yes, and it require B6 pyridoxal phosphate as cofactor. This aminolevulinic acid synthase is having two isoenzymatic form, 1 and 2. 1 is present in most of the organ, predominantly in liver, while allosynthetase 2 is present in erythroid precursor. Erythroid di means 2. Allosynthetase 2 is present in erythroid precursor. Question has been asked. Two molecules of delta aminolevulinic acid join to form porphobilinogen by enzyme aldehydatase. This ALA dehydratase is inhibited by lead poisoning. This is really important because questions are asked that lead poisoning, which enzyme is inhibited? Answer is ALA dehydratase. Many times we get confused between ALA synthase. ALA synthase is a rate limiting enzyme. Dehydratase is inhibited by lead poisoning. So in lead poisoning clinical scenario question, you will find multiple times that the worker of paint factory is there, or child eating paint from wall, or child playing with toys and putting these toys in mouth. These toys are having paint. So this type of history would be there, suggestive of lead poisoning. And in lead poisoning, they will ask which enzyme is inhibited. Answer is ALA dehydratase first. Lead poisoning also inhibit ferrochelatase. Lead poisoning recently asked question that also inhibit coproporphyrinogen oxidase. So these are enzyme inhibited by lead poisoning. This porphobilinogen, 4 molecule join to form hydroxymethylbilane. This hydroxymethylbilane is converted to uroporphyrinogen 1 spontaneously. So we can say this porphobilinogen ultimately can be converted to uroporphyrinogen 1 by enzyme uroporphyrinogen 1 synthase. Uroporphyrinogen 1 synthase, it is having 3 names. Yes, first is porphobilinogen deaminase, because ammonia is removed. Other name is hydroxymethylbilane synthase. And the third name is, yes, uroporphyrinogen 1 synthase. If uroporphyrinogen 1 synthase is deficient, one looks like I. That is leading to acute intermittent porphyria mnemonic. Yes, intermittent I intermittent. Okay. And I looks like 1 uroporphyrinogen 1 synthase. Name itself tells you acute intermittent porphyria will present with acute abdominal pain. And many times this pain is so severe you will do surgery. So multiple scar mark in these patients would be there. So acute intermittent porphyria, no photosensitivity, no cutaneous photosensitivity. These patients present with neuropsychiatric symptom, neurovisceral symptoms. So acute abdominal pain, multiple scar mark, uroporphyrinogen 1 synthase deficiency, acute intermittent porphyria. Another name for the same enzyme is hydroxymethylbilane synthase or porphobilinogen deaminase. Question is asked that in congenital erythropoietic porphyria, uroporphyrinogen 3rd synthase is deficient. 3rd looks like E. So uroporphyrinogen 1 is intermittent porphyria, 3rd is erythropoietic porphyria. So if the middle number 1 is deficient, so intermittent. If 3rd is deficient, erythropoietic. 3rd looks like E. So congenital erythropoietic porphyria make this type of mnemonic. Uroporphyrinogen decarboxylase is deficient in porphyria cutanea tarda. Cutanea means cut kiya. Tarda means toda. Cut, toda. What cut? What toda? Carbon dioxide. Out of all these enzymes, you will find only one decarboxylase is deficient. That is uroporphyrinogen decarboxylase. And that is deficient in porphyria cutanea tarda. Mnemonic is kata toda. Kya kata, kya toda? Carbon dioxide. Yes. Now you will remember that 2 oxidase are deficient. Those are coproporphyrinogen oxidase and protoporphyrinogen oxidase. If coproporphyrinogen oxidase is deficient, copro, name itself tells you hereditary coproporphyria. If protoporphyrinogen oxidase is deficient, this is a variegate porphyria. If ferrochelatase is deficient, that lead to erythropoietic protoporphyria. In all these porphyria, there would be cutaneous photosensitivity. Now we come to heme catabolism. Yes, when heme is catabolized by heme is converted to biliverdin. In this, NADPH and O2 join to heme and they produce biliverdin, they produce ferrous ion, and there is production of carbon monoxide. You know, carbon monoxide is inhibitor of complex 4 of electron transport chain if it is exogenous. But this is the only pathway where endogenous carbon monoxide is produced. Question is asked. So heme oxygenase or heme catabolism produce endogenous carbon monoxide. And which of the following is not a product of heme catabolism? Yes, heme catabolism, we produce ferrous ion. Yes, we produce ferrous ion. We produce carbon monoxide, endogenous carbon monoxide. We produce biliverdin. Yes, biliverdin is produced, not delta aminolevulinic acid. This is not produced. In fact, delta aminolevulinic acid is produced during synthesis of heme. It is not produced by heme degradation. Now the last topic is alcohol, your favorite alcohol. Whenever you take alcohol, this alcohol is metabolized by alcohol dehydrogenase. Alcohol dehydrogenase and aldehyde is produced. And you know that whenever there is dehydrogenase, removal of hydrogen, hydrogen will be taken up by NAD to form NADH. And you know NADH enter electron transport chain to produce 2.5 ATP. Then this aldehyde is further converted to acid by aldehyde dehydrogenase. Again dehydrogenase. Hydrogen is removed, taken up by NAD to form NADH. So in alcohol metabolism, when you take alcohol, NADH is increased. And NADH gives high energy. When it gives high energy, you don't feel hunger and you don't take proper food and there would be nutrition deficiency. One reason of thiamine deficiency in alcohol intake is poor nutrition, one cause. Second cause, that alcohol inhibit the absorption of vitamin B1, thiamine deficiency. So whenever alcohol is there, you will find that thiamine deficiency is there, and in treatment of alcohol related disorder, every time you use thiamine as a part of treatment. So I am telling you just for the information, I will discuss that part for the time being. Yes, alcohol metabolism will produce large amount of NADH. When NADH is very high, this NADH will bind to oxaloacetate and will produce malate. When NADH is very high, it will bind to pyruvate to produce lactate, lactic acidosis. Lactic acidosis or lactic acid will be increased. Pyruvate will be decreased, oxaloacetate will be decreased. Again, I'm repeating that NADH is high, that's why oxaloacetate will be converted to malate, so oxaloacetate is decreased. Pyruvate will be converted to lactate, pyruvate will decrease, and lactic acidosis would be there, lactic acid will increase. Ethanol, which we usually take, our favorite, ethanol, we should not take, that's not a good thing. Ethanol is converted to acetaldehyde. The acetaldehyde is converted to acetic acid, no problem. But if you take methanol, then it will be converted to formaldehyde, and then formaldehyde will be converted to formic acid. This formic acid will cause optic nerve damage. So if you take methanol or methanol poisoning, in methanol poisoning, there would be increased formic acid. Yes, increased formic acid, I just explained. And in methanol poisoning, this NADH will be produced. This NADH will bind with pyruvate to produce lactate, lactic acidosis. So recently asked question, methanol poisoning produce increased formic acid, increase lactic acid. Host trace D, spurious alcohol trace D, in which there was methanol poisoning question was asked. So for methanol poisoning, two questions recently asked, Hoch trace D, and second is increased formic acid and increased lactic acid. Now, if a person is taking alcohol for a long time, chronic alcoholic, thiamine is deficient. One question. If this patient come to emergency, he is not taking proper diet, now he is having hypoglycemia. Why alcoholic patient have hypoglycemia? I just told you alcoholic patient will have increased NADH. When increased NADH will bind with oxaloacetate will decrease, pyruvate will decrease. And when pyruvate and oxaloacetate is decreased, you know gluconeogenesis. First step of gluconeogenesis is pyruvate is converted to oxaloacetate. In alcoholic patient, NADH converted pyruvate to lactate. So pyruvate decreased. Oxaloacetate is converted to malate. Yes, oxaloacetate decreased. So there would be no gluconeogenesis. So question was asked that a chronic alcoholic patient presented in emergency with hypoglycemia. What is the cause of this hypoglycemia? Hypoglycemia was due to decreased gluconeogenesis. Question. Now, how you will treat this patient? Suppose this patient having hypoglycemia will come to you immediately. Don't give dextrose. What we think? We should immediately give dextrose. No. First of all, you will give thiamine. You will give thiamine. Then you will give dextrose. Why? Because dextrose metabolism requires thiamine. So patient is already having thiamine deficiency, and if you will give dextrose, then dextrose will not be metabolized properly and there would be increased lactic acid formation. Lactic acidosis will increase. Other than that, B1 deficiency acute precipitation may lead to complication of Wernicke's encephalopathy. Yes, so acute B1 deficiency may precipitate. So first of all, you will give thiamine, IV thiamine, then IV dextrose. Recently, a question was asked to check blood alcohol concentration. We do potassium dichromate test. Potassium dichromate react with ethanol. Ethanol is converted to acetic acid and potassium dichromate is converted to chromium. Potassium dichromate orange color is converted to green color. So intensity of color change used to estimate blood alcohol concentration. So to check blood alcohol concentration,